Wellness Waves, a podcast by Fortis Healthcare to discuss health and wellness-related topics with nationally renowned experts from Fortis. Join us on this enlightening journey and ride the waves of wellness.
Can you just explain how the robotic surgery in hip replacement?
As you may be aware, robotic technology is used in every aspects of our life now. And the robotic technology has entered our operation theatre also for many years. Nowadays, this hip replacement surgery is done using a robotic technology all over the world, and it has been tried and tested since last 15 to 20 years now. And it is becoming more and more popular all over the world. In the robotic hip replacement, what we do is we get a CT scan of the hip joint of the patient before surgery. Obviously, the CT scan will give you a three-dimensional measurement of your hip, or virtually we can make a virtual model of your hip even before the surgery. Even before the surgery, we know the dimensions, we know the size of the instruments which we are going to use inside the hip joint. We call them as implants. So once the CT scan has been done, during the surgery, we match your hip anatomy during surgery to the robot which has already got your virtual model. And hence, everything what we do on your hip joint will be mapped with a CT scan which is already available in the robotic machine. And hence, what happens is every measurement, every axis, every angle, what we have to learn, what we have to calculate, what we have to reproduce during surgery will becomes easy. So using the robotic machine, we also execute a plan which is done pre-operatively very accurately. For example, your hip socket as well as the hip stem is prepared with the help of the robotic machine. And hence, the planning becomes accurate, as well as the execution of the plan on the patient's body also becomes accurate. And hence the robotic technologies are being used more and more often so that the precision of your hip replacement becomes easier, because we will not be able to calculate certain angles inside your body easily using our open eyes, whereas a robot can calculate all those angles in a three-dimensional view.
Actually, that was an eye-opener. Really amazing. Robot in the operation theatre. Oh.